So now we're going to talk about a case control study that addresses the question, are bicycle helmets effective in reducing brain injury in cyclists? So the eligible population in this study, the population from which the participants were drawn, were all patients who came into 7 emergency departments in Seattle with bicycle injuries over the 2-year study period. And the cases in this study were those bicycle injuries involving either the head or the brain. And the control group in the study were bicycle injuries that involved other parts of the body other than the head or the brain. So the way they collected data in the study is they sent questionnaires to all participants, all the people who had been designated as cases or controls, within 7 to 14 days of the crash. Non-respondents, people who didn't respond to the questionnaire, were phoned 14 days after the questionnaire was sent. And so if you're thinking, you may be wondering, well, there might be differential response rate between the cases and controls. So if people had a head injury, they may be less likely to respond to the questionnaires. And that would be a very good point. But the researchers note in the paper that there was an 88% response rate across groups, meaning across the control and the cases. So that problem seems less urgent. In fact, 88% response rate is very high. So the first thing we want to look at is what we would call Table 1. So we're looking at what characteristics, we're looking at characteristics of the cases and the controls and how they differ. So first of all, we know that they're similar on the matching criteria, so that all the cases and controls were people that had a bicycle accident and showed up at the Seattle Emergency Department. And the thing that differs between them is the cases had head injuries, whereas the controls had injuries to the body, meaning not the head. So there were other characteristics that differed between the cases and controls, and it's important to note these. So the cases were younger than the controls. There were more males among the cases than the controls, and the cases had less education and lower income overall than the controls. And there were also characteristics of the accident itself that differed between the cases and controls. So the cases were more likely to have been hit by a car, more likely to have crashed on pavement, and more likely to have sustained damage to their bicycle. And finally, with regard to our main outcome of interest here, we saw that the cases were less likely to wear helmets than the controls. So the cases, 31% of the cases were wearing a helmet versus 57% of the controls. So this is supportive of our hypothesis, but we have to do some analysis to make sure that this is statistically significant difference. Okay, so we know that we just don't compare the means across cases and controls, the proportion of people who were exposed. That is not how we calculate risk in a case control study, but instead we use the odds ratio because we can't use relative risk since we don't have incidence data, since everybody had already been affected by the disease before the study started, and so we don't know the incidence. We cannot calculate incidence from a case control study. So we use the odds ratio, and we remember that this is the formula. So here's our data in this table. So we have 3,039 people total in our sample, and then this is how the people break down in terms of the cases and controls and exposure to helmets. So 203 total cases, 2633 total controls, 1558 with helmets, 1278 without helmets, and then this is how the helmets were broken down within cases and controls and no helmets. So to calculate odds ratio, we simply take cell A right here and multiply it by cell D. So we've got 62 times 1137, A times D over B times C, 141 over 1 times 1496. That comes out to here, and so then the odds ratio is 0.33. So this means that the odds are 0.33 to 1. So the odds of experiencing brain injury if you're wearing a helmet are 0.33 versus 1 if you're not wearing a helmet. So another way of saying that is you can say that helmet use is associated with a 67% reduction in the risk of brain injury. Okay, so I'm going to show some more data from this study just to illustrate a couple more points. So one is that you can look at levels of exposure when you're doing a case control study. And so far we've just looked at either you're exposed or unexposed. So in this case, you were either wearing a helmet or not wearing a helmet. But this shows that you can look at it in more detail. So these researchers looked at the type of shell on the helmet, okay? And so this shows the different odds ratios that are associated with these different types of helmet. Again, we also have the crude odds ratio and our adjusted odds ratio, and we haven't really talked about adjustment yet, but this was adjusted for age and whether the accident involved a motor vehicle. So another point here is to look and see that this is a reference group here. So when you have any exposure in which you have multiple levels of exposure, and this happens very frequently, you will have the unexposed group or one group function as a reference group, and then the odds that are cited for the other levels of the exposure are all in reference to the reference group, which is the unexposed group. So I'll show you one example of how we calculated the odds ratio for one of these levels of exposure. Okay, so down here we're just calculating we're showing how the odds ratio for hard shell helmets was calculated, and it's the same for the thin shell and the no shell, but I'm just going to show it to you for the hard shell. So we've got exposure in the first row, because that's how we've learned how to calculate the odds ratio. So what you can see here is that we have the 23 cases who were wearing a hard shell helmet, and we have 741 controls who were wearing a hard shell helmet, and then we take the unhelmeted, the reference group numbers down here. And then we just do what we did before. So we just take, this is cell A times cell B, 23 times 1137, and then cell C times cell B, 141 times 741, and then that gives us these numbers, and divide, and then we get the odds ratio of 0.25. So we see that a hard shell, and here's the ratio, the odds ratio up here, a hard shell is even more protective than a thin shell or no shell. And the other thing we can look at here, just remembering that looking at their confidence intervals, so we know our question could be, well, is this actually better? And we know that we can see the confidence interval, and we can actually see that 0.25 is not within the confidence interval of the thin shell, okay? And then the thin shell, 0.41, is not within the confidence interval of the hard shell. So it looks like pretty clear that these two are different from each other. Now this one has a much wider confidence interval. Why is that? Well, probably because the number of cases that had no shell were very low. So these helmets, I guess, were less common. So it's so you have a less precise estimate here because your sample size is lower. But anyway, so that's an example of how you can interpret these kinds of tables. So I'm going to stop here with this video because it's getting too long, and in the next video we're going to talk about control groups a little bit more. It'll be a short video, but then we're going to return to this study and ask some questions about the control group in this study.